People are following the website very closely as they're making their own decisions about whether they go out or not. One question we get often is, are you going to release zip code level numbers that you've talked about here in this forum? And secondly, people being confused with the new website on how to track deaths. Like today, the numbers that if you add up the numbers, it's not going to add up necessarily to what gets reported. People are confused by that.
So the overall death is accurate. The number is right. It just, the time lags with when it comes in, and so the overall case reflects the actual number, and that's based on the date on the death certificate. So sometimes that lags in how we report them. So even though we have a number that's reported today, sometimes that's actually reflected over the previous 3 to 4 days, depending on when it comes in. So the number is right. You will just continue to see. Am I explaining this right? Okay. You will continue. I don't want to verify, but this is how as I'm going through it too, I spend a lot of time on that website, just like Iowans, looking at the data. But as it comes in, then we will adjust the numbers based on the day the day of death that's on the death certificate.
You may not want to do this, but people are asking, would you consider returning to announcing the numbers?
Well, they can get it every day. You all announce it every day. You're doing, as before I come into the press conference, I get alert after alert from the media that's recovering. So we just, you just can't focus on one thing. We need to look at 3-day trends. We need to look at 14-day trends. We need to look at the positivity rate. That's continuing to go down, and that's great. Yesterday, I think it was, 7.7 or almost 8%. Overall, it's like 14.1%, and that is really kind of a reflection of the testing that we're able to do. So, the more that we test, that is going to fluctuate. So our positive numbers are going to continue to go up, but we need to look at the trends, and we need to look at the positivity rates, and we need to look at the days to double. I think that's at 23 right now, which really speaks to the spread of the virus. So that's a really positive number. We had 14. I think our hospitalization numbers were down 14 yesterday. They've been extremely stable. Now we're watching that every day. I'm laying in wait for that report to come in about 3 o'clock every day, so I can see, how we're doing as a state and how Iowans are doing to respond to the pandemic. So there's a lot of positive things, and again, nothing is a mandate. People have to be personally responsible. If they feel comfortable, go out there, tiptoe into it, take your face covering if you can't social distance, and businesses. I just continue to be so incredibly impressed at the responsible and thoughtful manner that they're taking in reopening their businesses.
Just zip code.
Oh, you want to talk about that?
No, I would just say thank you for the question. And again, I think, we fully appreciate that when things change, it can be a little bit hard. I think that our goal all along has been, as we learn more, to turn around and make that information as readily available for people as quickly and clearly as we can. So we are looking into ways to do that, to make sure that, again, as we receive information that helps Iowans to make safe and healthy choices, we're making that available.
That's what our whole intent of the website is, so that Iowans can get some sense of what's happening in their community. But with any website and any new venture, there's bumps along the way, and so I don't want to cause a lot of concern when we're not, when we shouldn't. So we just want to make sure that the data that we're collecting is good and sound, and it is. And I've got an epi team that's also poring over it every single day, and the Department of Public Health that's pouring it. Got a lot of eyes on it. So our goal is to continue to provide information so Iowans, so that they can be informed and make their decisions based on what they're seeing.
Channel 13, go ahead.